In less than 2 years, COVID-19 has already infected 200 million people and killed 4 million. It is the worst combined health and social economic crisis in living memory. Taking vaccine is the only way to kill the outbreak of the COVID-19. However, as of May 2021, surveys indicate that close to 50% of Americans will or have refused to take vaccine. Meanwhile, a global survey found that 30% of respondents would now be willing to take a free COVID-19 vaccine. Vaccine hesitancy is not a new thing. In 2019, the World Health Organization has already listed vaccine hesitancy as one of the big threats to the global health. But why does the public not COVID-19 vaccine? More generally, why does the public not take vaccines? A better understanding of these questions can help us control the COVID-19, but also prepare us for the future crisis, which requires cooperation between the public and the government. To answer these questions, I studied the relationship between the different types of trust and the public's compliance with a vaccination. Drawing on the 2017-8 national surveys and using a computational technique, I created a trust data covering 154 countries and 47 years from 1973 to 2020. The preliminary results show that trust in representational institutions, including national government, Congress, and election system, increases the public's compliance. I expect to see trust in implementing institutions, including public health system, social service system, etc., has a more substantive effect on public compliance. Trust in implementing institutions usually receive a less attention. However, public's evaluation on whether policies are implemented drastically influences their compliance behaviors. Facing the rising social, economic, and racial inequality, the widespreading of the misinformation, it is time for the policymakers and policy implementers to rebuild the public trust toward them, to end the evil circle of lack of policy reforms and public distrust.